Sunshine's Corner, being brought to you by Quint and Richie Studer.
And a beautiful Wednesday morning to you. Sunshine's here with you. Well, you know what I always tell you on Wednesday, it is hump day, and believe me, it is all downhill from here in. But you checked into the best place that you could ever be. That's right here at Sunshine's Corner. We keep you entertained, informed, and definitely going to give you the knowledge you need so that you can make a difference right here in our community. And today, it is not going to be a difference. Why? Because we call it our Wellness Wednesday. And we've got my friends from Baptist Healthcare. They are in the building today. Yay! And we're going to talk about a whole lot of good stuff because really, now think about this, ladies and gentlemen. As we know, yesterday was October 1. So October is Breast Cancer Awareness Month. And what better way to start off a conversation than all of my good friends there from Baptist Healthcare. And let's get an introduction first of all. I'm going to go down to my far right. We've got my girl, Joy Powell. She is the Director of Community Health. Hey, Joy.
Hey, Sunshine.
So glad to have you with me this morning with that big old pretty smile on your face.
Good morning. Good morning. Thanks for having us.
But of course, right to you is Melissa Salter. Yes. She is the Senior Manager of the Cancer Support System, right?
Yes, that's correct.
And right here to my immediate right, we've got Kelly Ward, and she is the Breast Health Navigator.
Yes.
Look at these names that I've got today. So we've got some conversations today because, you know, I like to keep this top of mind with ladies. Number one, I want to encourage you to make sure you go get your mammograms.
Yes.
Because early detection saves lives.
Yes,
That's
it does.
correct.
And with these ladies today, I know that this conversation is going to be so fulfilling on things that you may not be aware of, or should I say, sometimes we'll put them on the back shelf and say, oh, I will, or I'm going to. And we tend to let that shelf go further and further back, thinking, oh, no, it's not going to happen to me.
Yep.
But that's the mindset we don't need. So, Joy, I'm going to throw it to you first. So let you start, because you got something special you want to say first of all.
Yes, I do. I'm not the expert. Yeah. So today is a very special day. Yes. Today is my husband, Caleb Powell's 50th birthday. So happy birthday, baby. I love you so, so, so much.
Oh, isn't that beautiful? I just got chills.
Yes.
I get them sometimes too.
What better way of love is a beautiful thing.
Yes, it is.
Look at that smile on the face. You see it?
Yes,
Yeah,
it
she's
is.
shining.
She is absolutely
She is
shining.
glowing.
But listen, let's come right to you, Melissa. Let's talk about what you do.
Yeah.
First of all, tell everybody what you do, how long you've been doing, and what is it that desire that keeps you going to do the work that you do?
Yeah, well, I'm the Senior Manager at Baptist for Cancer Support Services, and I've been in this role for coming on a year now.
Okay.
I actually started as a social worker. I'm a social worker by trade.
Okay.
And I came in the oncology department as a social worker and was able to work my way up to being over the department. So it's really been a great transition for me, and it really feeds the passion I have for cancer care and the patients that we have and how we can impact their lives by just being a support for them throughout their care.
Right.
So like I said, I've been in the role for about a year now at this point, and I have a wonderful team like Kelly, I have navigators, social workers, dietitians, just all around support for our patients when they come in our doors.
Absolutely. Now we're going to roll right on over because we're going to give everybody their time to share that good thing that you do. And Kelly, she was really saying how much that the two of you all work together, and with you being that person who is the navigator, let's hear how you navigate all of these great things that you do.
So I actually started out as a navigator in 2017.
Okay.
I have been doing it for several years now. I actually am a social worker by trade as well.
Okay.
And Melissa and I actually worked in child welfare together.
Yeah.
And
Really?
then came over to Baptist and was really interested in that social work role, came into oncology, got to know the breast cancer patients, and really developed a passion for that community.
That is
so the opportunity arose, and I took it, and I have loved every second of it.
I don't blame you at all.
Yeah.
I mean, but you see, I see now whereas with the director of,
Actually, it's not even a director anymore.
Yeah, we have a new title, don't
What's
I
her
have a
title
new
now?
title. I have a new I'm just a girl Friday. You know what I mean? I just, whatever people need, I become it.
Oh, hello, I know the feeling. You wear that
so
hat.
that's titles are not important to me.
Absolutely.
But,
Say that one more time.
Yeah, titles are not important.
Yeah.
Whatever people need, and I want to say we, not just I, we, our organization becomes it. we were talking about, and I want to make a plea to women.
Okay.
If you're a woman over 40 right now and you're listening to this, you see that number, 850-432-7768. Call in with your questions.
Please.
Call in with your questions. Text your questions. If you want to remain anonymous, that is fine.
That's fine.
But we have to put an end to this disparity. In our communities, with an S, all over the country, Black women are diagnosed slower than white women, but we die faster.
Okay, now say that again.
Yeah.
Black women are diagnosed slower.
Meaning white women are diagnosed,
Okay.
their percentages of diagnosis of new cases are higher
Then, okay.
because they catch it early.
Okay, but we?
We gonna make sure the baby got everything the baby need, and if we
And
got a
then we'll
lump
go.
and the baby starts sneezing, we forget about the lump. And all women do that, so
Of
that's
course,
not a
of course,
color
of
thing.
course, of course.
But that's just all women do that,
Right.
right? And so just wanting to make sure that you are calling in with, because you have the experts here.
Exactly. Look, now we got a panel here today that nobody needs to miss out on because
At
no
all.
question. And I tell everybody, don't. I mean, just like you said, you don't have to give your name. I mean, but it's the fact of it is that this is the time when it's absolutely free for you.
Yeah.
It's confidential. I tell you every single day, right here at Sunshine's Corner, this is the place you can have the difficult conversation and feel safe doing it.
Yes.
You can call in, and believe me, nobody's going to try to judge you, to say anything in the way to make you feel bad, but to only make you feel bad, to uplift each other. I think, personal pronoun, think it's time for women to uplift each other and to help each other anyway.
Absolutely. And I'll tell you, when I'm involved with a patient, there's many times when I talk to patients who say, I didn't come in because I was scared.
Right.
I was afraid. I didn't want to know what was there. I thought if I ignored it, it would go away. And then they're in a situation where it's caught much later. Prognosis is a little bit different.
Right.
So I do encourage patients to, if you've got questions and you need answers, don't hesitate to call, because like you said, we're here to lift you up and to support you.
Absolutely. And it takes that, a teamwork that would got to be, because that's got to be a very much so a traumatic when you find out.
Absolutely.
It's got to be.
It is very traumatic.
And one thing I heard, I think it was somebody say,
Yeah.
but in the fact of it is, some people may think, I don't have enough money, or I don't think I can get that, but if I can't get it, I can't afford it. Little Susie over here, I got to get the milk, but I can't afford it, so let me get the milk first.
Right.
Yeah, I was just gonna say, I think something else that we can highlight is at Baptist, I can say specifically and speak confidently too, is that we do have a mammogram fund.
Yes.
So if you are uninsured, if you are underinsured, if you are going to the community clinic and you identify a lump and you need to get a mammogram done, Baptist will welcome you with open arms. You do not even need an order from your physician. You can call directly to our Women's Imaging Center and they will get you scheduled, and Baptist will ensure the payment of that mammogram so that patients are able to get
It's
seen.
actually funded through our foundation.
Yes.
You know, your girl Casey and
Yes.
Heather. And
That's my
actually,
girl.
we have an event coming up October 12th.
Okay.
On the north end of the county at the 9 Mile location, where it's called Sister for Sister. And so today, right now, if you dial 448, because Baptist has a new area,
Yes, we do.
448-227-7729, and ask for Alicia Williams, we can get you scheduled. Even if you don't have a PCP or a primary care physician, we can get you seen maybe at one of our partners like Community Health of Northwest Florida or Health and Hope, if you're under or uninsured, to make sure that we have a place to send the results to. That's the important part. But if you're having symptoms, we don't want you to walk into us that day. We want you to go through and get what you need as far. She's touching on herself. She's
No.
I said symptoms.
I'm saying, my question is, what is a symptom, but other than the knot? I mean, the bump.
Kelly got that.
That is, so anything palpable, you should be doing your breast exams every month.
Right.
Most times it's best to do it in the shower when you have the capability to do it and do it effectively. But anytime you feel a lump and you say, this is not normal, something's just not right about this, or you have some
Extreme tenderness,
or you have discharge from the nipple, things like that are symptoms that you need to have taken care of, need to be seen.
And one of the other things, if you feel, we think about the knots, right? We think about what we do. But if you go under the arm a little
That's
bit,
where I wanted to go.
Correct.
and if you feel something, it's
for sure.
best.
Yes.
It is best not to go to Dr. Google.
Yes, please don't.
Dr. Who?
Google.
Yeah.
If I could take all healthcare information off Google,
Yes, I would.
take it off.
Yeah.
That is funny.
We all do it.
Okay, people, don't go to Dr.
Don't
Google.
go to Dr.
Please don't
Google.
go to Dr. Google.
Go to Dr. Baptist.
Yes.
Yeah.
Yes, Dr. Baptist.
Go to a
Yes.
doctor at Baptist.
There you go.
One of our physicians has a coffee mug that says, "Please don't confuse my MD with your Google search."
Yes.
Yeah.
Yes. They need a credential after the name. That's what we need.
You know, and we
Yes.
are so tuned to, because I know when I could just thinking in conversations I have with people. Oh no, let's Google that.
Yeah.
We can, let's Google that.
Yeah.
Oh, I scratched my toe. Let's Google that, how to put a bandage on. You know what I mean? But
Yeah.
oh
Yes.
my God, ladies, this
Yes.
is really good. Please don't call Dr. Google. I'm going to be using that from now
Yes.
on.
Please
and
don't
you
call
know
it.
it.
Yeah.
I mean, that Dr. Google, that's funny, but it's a fact.
Yeah,
It is.
And you know, I want to say something to Joy, the screening program that Joy does, the Sister to Sister. We have had several patients find lumps that they would not feel, that you couldn't feel, doing it through a screening mammogram, that got them the early detection, early care that had a very successful treatment. So I just encourage people to take advantage of that program and to get your mammograms, regardless of your insurance status, do it.
And we model it after the military, right? Because back in the day, people used to go in the military as a buddy system.
Right.
You know, we graduated from high school together, we're going to enlist together,
That's right.
So we did that so that if I don't have insurance and
Melissa
my
does.
baby Melissa does, and we're both of age, she could say, hey, come go with me.
Yeah.
Right.
Sister for sister. So I'm bringing
I
you
love
with
it.
me. And we make it fun. We give them a little pamper box, and so they can leave. But we're open. It's a Saturday.
Yeah.
So
Because
you
we
don't
know
have to worry about
access.
going to work.
Right.
No, we know access
Access.
is a big thing. And we also understand that there's a lot of need in the 32514, which is where we're doing it this
Absolutely.
time
Take the
at the
zip
9
code.
Mile location.
Yeah.
So yeah, it's amazing. We've seen a lot. We've seen a lot, and we follow them. To Melissa's point, the foundation has a fund set up that is all through philanthropy dollars, right? So we don't have the restrictions
Right.
that some people have because they have federal dollars.
Right.
So we're a little more relaxed, right?
Right.
So basically, you just have to be over 40, have a doctor, somewhere to send the results.
too.
When I say have a doctor, that means you have to see the doctor within a year.
Yes.
It is not your doctor if you have not seen him or her within a year.
Yeah.
Well, now, let me ask you a
Active
question. Let me
patient.
pick it up
Active
there.
patient.
Now, let's say if there's a person you find that they do find a lump, they have not seen a doctor, and it's been over a year. Now, what are you going to do with that
Well,
person?
here's the thing. If they follow the scheduling of the Sister for Sister, when you call in and Alicia asks you those questions, have you seen your provider in a year? If you say no, we're immediately going into
Wonderful.
barrier reduction and getting you an appointment with a provider.
Excellent. So there's no...
There's no barriers.
Yeah.
no, that is-
It's true wraparound care.
Yeah.
And I
Okay.
think that's something that is so beneficial to just the community in general. A lot of times you can identify what the problem is or what the barrier is, but programs like Joy's Faith Health Network, our screening programs, it's really identifying how can we wrap this person around with support and with care to be able to hold their hand through it, get them to where they need to go, and then identify what the path is and follow them.
Wow.
And overall, that a lot of times with Baptist, we have a slogan from screening to survivorship. That's
Yes,
our logo, our slogan. And that is the true essence of it, is taking a patient from screening to hopefully be able to have early detection through diagnosis, through survivorship.
Absolutely.
And that's our goal at Baptist, is to be
That
able
is
to provide
wonderful. We got a
that.
call. Somebody want to talk to
Yes.
somebody.
Yay.
Let's see here. And good morning.
Good morning, Sonshine.
Good morning.
I had the call. I heard the young lady say that they modeled something after the military. I was the maintenance leader for the Naval Hospital for 7 years.
Yes.
And in the mammogram area, they had a display of breast and how to feel irregularities that were in it. Well, after a while, they got to joking with me because they said, Mr. Wooten, you ought to be an expert at that by now. Because I was concerned about my wife
Absolutely.
and her history as far as her family was concerned. So my thing is the spouse, and I'm going to keep it as far as husband and wife.
Okay.
The man can be very influential when it comes to determining whether or not there's some irregularities that have developed over a while, because
come on now.
you're together for years.
That's very true.
Help
And
them
you
people.
have that intimacy,
Yes.
and at the same time, in leaving, it's beneficial for the relationship to show the concern for a man to be involved in breast cancer. And when the lady said that you have to go underneath the arm,
Right.
that was a strategic place that was in that display that says that a lot of people miss that.
Yeah.
But that's where a lot of the pressure is, depending upon the
There
side.
under the arm.
Yeah.
So God bless you all.
Thank
and
you.
thank you for the subject matter, because it's very important, especially when it comes to women of color.
Yes, it is. Thank you so much, Kingdom Walker.
Yeah.
Supernatural blessings.
All right, thank you. Now, Kingdom Walker is the man.
I was saying that man said his name was Wooten.
Yeah,
Yeah.
No, his name is Mr. Sylvester Wooten.
Okay.
But everybody calls him Kingdom Walker.
Gotcha.
He has this prayer list that now I moved here 20 some odd years ago. Now he put my name on that list. That list is that thick now. And it's from people all over the world.
Wow,
Oh,
he
that's
just prays over
amazing.
it.
They pray and they pray.
That's amazing.
All over the world, people,
that.
they got this prayer line.
Yeah.
Which is so good. I think that's also a point with the ladies when we do. Let's say this too. Thank you, Lord. Men get breast cancer too.
Absolutely.
I've
Absolutely.
had about 2 to 3 patients a year that are men. Yes. So, and then it's important if men feel the same sort of symptoms, the same tenderness, abnormalities in the breast when you're showering, it's important to feel those areas and seek medical advice when you notice it.
Yeah.
You know what? I find that amazing because, men, you may think, no, that's a woman thing.
Yeah.
But, I think the first person that I read about that had it was Shaft. From the movie Shaft. He had
Oh,
it.
really?
Yes, he did.
Okay.
He passed away at 80 recently,
Yeah.
but he had breast cancer. And the fact that it is what we're saying is we're talking about a subject that fits everybody. So therefore, if you're a man or a woman, if you're red, yellow, black, white, or brown, that's you, and all this information we're talking about also fits you.
Yes.
That wellness we're trying to convey to everybody is for everybody. And you ladies are absolutely filled with a lot of knowledge that what we're talking about now. Kingdom Walker made a great point. Husbands, you know your wives.
Yeah. Very true.
Husband, how can I say it, George?
He said it.
He said it.
You know.
You know, you've been there with her 30 some odd years, 40 years.
That's what the Bible said, and he knew her. And
That's right.
That's the word. Knew.
That's right. He knows.
And
Yeah.
I think it's important for a man too, when you notice those changes in your wife, to help remove the barriers to get her to
Yes.
the treatment.
Right.
that
That's
she
good.
needs.
Exactly.
That's good.
And
Say, I'll
walk
pick up
through
the
it with
kids
her.
today, or I'll take care of the grocery shopping this afternoon. You go get your exam.
You go
Absolutely.
be seen.
Absolutely.
Or
Ladies
even
and
I'll
gentlemen,
walk with you.
Right.
there you go.
Absolutely.
That's what we're going to talk about that next, because when a person finds out that they are that person with the cancer, right? How do we deal with it? Because I know that their mindset is going to be
Yeah.
something totally different. This is Wellness Wednesday, and of course today we are talking about breast cancer, with October being Breast Cancer Awareness Month. We want you to take the time to please call us at 850-432-7768, or you can text that number as well. But the fact of it is, pick up the phone and call. We got the experts with us today right here on Sunshine's Corner. And let me say this before I go. Let me say thank you to all of my breast cancer sponsors that are walking with me in the Making Strides Walk that's coming up on October 29th. Thank you to Sonny's Barbecue, Ron Helms. You know him at District 4. And of course, we've got Stalworth Insurance Company also is going to be walking with us. So look, make a difference. Let's join this fight together right here at Sunshine's Corner.
Good day, Pensacola. Welcome to a new segment on health and wellness sponsored by Baptist Healthcare in partnership with Sunshine's Corner. Every first Wednesday of the month during Sunshine's telecast, we're going to be bringing you information about health and wellness and ways to make sure we're improving the quality of your health care here in Pensacola. After all, we want to ensure that you're going to the right place at the right time and for the right reason, and that you don't feel alone. Can't wait to see you.
Many who consider facial plastic surgery are concerned their results will look unnatural. But with over 20 years of serving the Pensacola community, his thousands of satisfied patients have made Dr. Derek Jones a trusted reconstructive and facial plastic surgeon known for industry-leading results that look natural. Call 850-484-FACE to schedule a consultation at one of our locations in Pensacola and Gulf Breeze.
I'm Dr. Derek Jones. Trust your face to a facial plastic surgeon.
I vote because my mother voted. She was 40 years old, and I was 20 when she first voted. She said, Mamie Lee, take me to the registration office or wherever I need to go so that I can register to vote. So I vote for that reason, and I want everybody else to vote. Don't just talk, you gotta walk it like you talk it, and when you walk it, you are voting. So vote. I'm Mamie Webb Hickson, Director of the Writing Lab at the University of West Florida. Just vote.
It's the hardest conversation I have with patients, telling them that their baby won't make it. And now, because of Florida's extreme abortion ban, I also have to tell them I can't help. The ban forces women to wait until the brink of death to get care and could send doctors like me to prison just for treating my patients. That's terrifying. And it's why I'm voting yes on 4, to end the ban so government can't stop women from getting life-saving care.
And welcome back to the hottest spot in town. This is a place where you can get all the information that you definitely need. And I always encourage you, if there's something that I overlook or if there's something you feel that I should have touched, call me. 850-432-7768. Text me, 850-432-7768. This is how we make change. Yes. This is how we begin to do better when we conversate. We have the conversation to talk about the things that's affecting us. And I want to also relate to this. Now, we are surely focusing on breast cancer awareness in October, but this is January through December.
Yes,
okay?
it is.
Don't just wait till October. And let me say hi to my girl, Casey.
Yeah.
Hi, Casey. We have worked so much together with the mammogram program.
Yeah.
I love her passion, and I've seen things how it helped people. We did a program once, and there was a lady that I knew that got the opportunity. She got the mammogram, and there was something there.
Yeah.
And I mean, but this is the point we're talking about. With you navigating every day, with the both of you, I think that's great that you're coming from social work, so you know how to work with people. And Joy, you know, she don't ever stop.
Yes.
I mean, I'm just saying, she know how.
She's a force.
She's
for
a,
sure.
there you go.
For sure. In the best way possible. Yeah.
Exactly. And with the event that you all have coming up on the 12th, that's going to be at 9 Mile Road. That's the 32514 zip code.
Yes, it is.
Yes, it is. So we want to invite people to come out, sister, and bring your sister with you.
That's right. But don't just show up. Call 448-227-PRAY. 448-227-7729. Register to get a mammogram. It's not an event, it's a screening event. So we won't have, vendors, and we will have people coming in. And this is sometimes, y'all, like Kelly said, this is fear. So we don't want a lot of crowd unless you're there to be screened.
Absolutely.
Or you're there to support someone that's being screened. Because this is personal.
Of course.
This is personal, right? So hey, just do it, like Nike says. Just do it.
When you get people, when you run into people, and how is it with the two of you when you find out that person's right there with you? And it's got to be feel like a ton that just hit you in the chest that you said, yes, there's something there, we got to do this, we got to do that. How is it that you get that person that you're talking to come on? I know what's running through your head, your thought process.
Right.
Now, how can we get you back on this side?
Right.
Yeah.
And I'll tell you, when I meet with patients, it's typically at the time of diagnosis.
Okay.
So they're getting the news, you have breast cancer. And they most of the time have somebody with them, and it's a shock. They don't go into that room thinking this is going to be breast cancer. They're thinking, oh, this is going to be nothing. It's going to come back benign. It's going to be fine. And then they hear nothing else other than you have cancer, and nothing else you say to them do they hear.
Oh my God.
So that's important to have your support person with you to be able to take away what's being said and to remind you afterwards. And really just the goal of a navigator is to meet the person where they are, mentally and emotionally. Hold their hand, love on them, support them, tell them we're going to get through this together. We don't know what tomorrow looks like. We know that you're going to take tomorrow, and we're going to do one day at a time.
Absolutely.
And we're going to face that day as it comes, and whatever challenges it brings, and whatever joys and wins that we have, we're going to experience them all together.
Absolutely. Now, when you talk to a person, and sometimes I'm sure when it's the first thing they're saying, am I going to live?
Yeah.
Am I going to make it through this? How do you handle a person when they have that? When they start going through the chemo, when they're going through the fact that you may lose your hair, all of that has got to be a process. Because I freak when I see just a little mind break.
Yeah.
You understand what I'm saying?
I understand. Yeah.
So what is the approach you're the professional. That person that's hurting, that's detriment that they feel on the inside. I'm thinking about my children. I'm thinking about this. I'm thinking everything is going on in my head 90 miles a minute. How?
Yeah.
What do you say?
And you know, that's interesting that you say that, because I can talk to a patient as long as they're sitting in that chemo chair, and I can encourage them and support them, and hopefully when they walk out they're feeling better. But when they get home and they're starting to get sick, those emotions start deteriorating again. They start falling back, and they're afraid most of the time to talk to their loved ones about how they're feeling because they don't want to burden them. And the loved ones are calling me on the other side saying, I don't know how to talk to them because I'm afraid to upset them. Communication is key. It is so important when that patient is feeling sad and depressed and lonely and frightened, that you communicate that to your support system so that they can better support you. And it's beautiful when they come together and they're holding each other up, because the loved one is feeling the same things the patient is too, just from a different, you know, it's not me, but it's the person I love sitting there in that chair.
Absolutely.
So communicating, and I have seen relationships just blossom and grow, and it's beautiful when that happens. It's getting over that hump and those fears.
Now, the early detection, let's say if a person comes in and they find out that it's stage 2, 3, right? With that, now we want to focus on to make sure everybody, you get your early detection, okay?
Yeah.
But if there is a person, when they come in, they go through the testing and they find out that it's advanced, and the process with that chemo that starts, and if it's advanced, so there's going to be a more aggressive. So what's the steps that you go through with that to, you know, do you understand? I mean, I'm visualizing in my head right now. If you tell me I have stage 3, and I'm really going to think, oh my God,
Yeah. And that's part of the frustrating thing too, because every cancer is taken serious, regardless if it's stage 0 or stage 3, 4.
Right.
And we try to do the workup very quickly to get them moving into the course of treatment so that they can get this behind them and they can go on to doing what they love to do in life. So whenever you have a stage 3 or 4, it's really just orientating them to what to expect. A lot of the things is the unknown fears of what I'm going to experience. Is walking them through the chemo suite before they start chemo, giving them a tour of the building, telling them what to expect chemo day, what their cycle is going to look like, how it's going to look like after treatment, what to expect when you get home. That oftentimes eases fears. So you get home and you're like, oh, I feel this certain pain. Oh, they said that was normal, so I'm okay. You know, it's
knowledge is power. Knowledge is power.
And I was going to say that is why having a navigator is so integral to a patient that is coming through with a diagnosis, because a lot of times patients get lost in the system. Like they, you know, workup is happening, they don't know all of the details of what's supposed to happen, what time frames are appropriate. Okay, now I'm diagnosed, I'm starting treatment. What does that mean? What should I expect? So having someone as amazing as Kelly to, you know, take you and take the time to walk you through the suite, show you what the infusion center looks like, connect you with the nurse to say, okay, these are things that you should be looking for. If you experience this, call us. That's not normal, or that's something that we need to be able to look at and look at further and see what else needs to be done. So it just helps you to have a support person to walk through that process with you, that can answer questions. Kelly also hosts a support group every month for breast cancer patients. And that's part of the connection and forming relationships. A lot of times shared experience is something that you can connect on that your family may not understand, because of course they're coming at it from a perspective of someone that loves you, but they're not the person actually experiencing a diagnosis of cancer and going through treatment. So when you're able to connect with other patients that are going through the same thing that you're going through right now, or have been on the other side of it, it gives you a different level of connection and being able to have that as a support. So we do have that as well, additionally, for people who may not have family.
Absolutely.
You know? And that's where I was going to chime in. We have to take the limit off the word support. Right? Because I'm here, and my mother, my grandmother, most of my family is in Memphis.
I understand totally.
But I have a group of friends. Right? And then what if you don't have a group of friends? What if you know, it's your church? So the thing about it is, we have to remember, no matter what you're hearing, don't stop showing up. That is one of the things when we talk about early detection. Because I don't want to have them in a state of fear when we're talking about stage 3, stage 4. So, you know, there are steps. you know, if you've never had a mammogram before and you're 55, they don't have anything to what's the word?
Baseline.
A baseline. So you don't have other scans that they can say, oh, this has been there. So you may have to go through phase 1 or phase 2. That doesn't mean you have cancer. That just means that we're making sure everything that you have is normal for you. What's your normal?
Okay.
Because you hear women talk about, I have dense breasts, or I have this, or I have that. And then you hear people say, it hurts.
Yeah.
What's a dense breast?
Look at her face. I mean, that should have been a thumbnail.
When you have dense breast tissue, so the tissue within your breast is actually dense. And so you hear a lot like women have fibrocystic breasts where they may have cysts in their breasts, or they may have like lumps that aren't necessarily cancerous lumps. So the breasts are, they have a lot of nuance. So when it comes to it, you know, when you have patients that have dense breast tissue, when they get an image like a mammogram, it may not be able to see completely through the tissue in the breast. So you may need to get a more upgraded imaging like an MRI to be able to see through. So it just depends on the person.
A great analogy I heard one time is think of a forest that's full of trees and bushes that it's hard to walk through. That would be considered dense. If they're scattered in the forest, you have a tree here, tree there, it's fun to kind of walk through, that's not dense.
Can't see the forest for the trees.
Can't see the forest for the trees.
Yes.
And our mammogram program through the foundation follows that. So if you show up and you get a mammogram and then you need an MRI or a diagnostic, that follows you. I mean, the funds follow until if you are you know, diagnosed.
And then we have
there we go. Then other things come up, right?
Yes.
So don't let finances be a barrier. Please don't let finances be a barrier.
So if there's a person who's lacking in the finances, who maybe perhaps got part of the insurance or may not have insurance at all. Now they can still call 448-227-7729. Pray.
That's how I know.
But so I want to reiterate that because I'm sure sometimes never be embarrassed.
No.
Don't be embarrassed. We've all been down that road one time or another where things have been difficult. And it's okay. But you see, that's why our Heavenly Father has put someone there that can help you if you do not have those funds, or you may not have the insurance that you need. So don't feel bad that you don't have it. Feel good that there's somebody who has it for you.
That's what it was created for. That's the purpose. Because there's so many people in that situation.
And it's never too late. And today, with how it is, come on, it's understandable.
Absolutely.
It is certainly understandable because I mean, you think it. You go to the grocery store, you come out one bag out of your hand, you got 2 pieces. And you spend $50. Come on, man.
And I think it's important to know it's never too late. A lot of times you also have that shame of, oh, well, I haven't done it this long and I'll be okay. It is never too late to start. If you are watching this today and you are someone who is of age in order to get a mammogram and you've never got one before, 448-227-PRAY.
Yes,
we will get you in our doors.
448-227-7729. Ooh,
there we go.
And then you know what else? Honestly, the number, the 448, Baptist's new number is 448 Baptist. So we're trying to make it easy. That's one of our strategic priorities, making it easy. So I'm gonna give you a shameless plug for next month's Wellness Wednesday. So a lot of our residents, a lot of our people have lost their Medicaid.
Yes, they have.
Because of some things involving your address and other things. So next month's Wellness Topic Wednesday will be on what you can do to find out if you are still eligible for Medicaid, and if you're not, how you can still get insurance, because access is what we're talking about.
Absolutely.
Right? And until we can curb that, that's how we make Pensacola healthy. We make sure everybody has access to health care that they need and that they desire.
That's right.
Right, and so that's going
to be coming up on next one. I tell you, I just love what we are doing.
That's right.
Yes. That's right. If we are doing this, and I want to say to Baptist Hospital, my hat's off to you, because I know I've been working with Casey for years.
Yes.
And I know this has been going on for quite some time. Again, let me say thank you, because this is Breast Cancer Month, through our sponsors that's going to be walking with me on October 26th. I want to make sure you're there. Come on out and grab a t-shirt. It's going to be with Sonny's Barbecue. Thank you, Ron Helms. And of course, Starworth Insurance. And if you would like to be on that t-shirt, call me. I can do it. Right here, Sunshine's Corner. We'll be back with more.
You finally found the perfect car in racing blue. You even got them to throw in the LED fog lights for free. Auto Owners insures your car because some people never learn to parallel park. That's simple human sense.
Ask the Messick Insurance Agency in Pensacola if auto owners make sense for you.
Keep going, more. No, stop!
I am going to vote. I vote because I want my voice heard. For many years, people like me were silenced. Women were silenced. So I vote to make sure that my voice will be heard. I'm Dr. Yvonne Capehart, and I encourage you to just vote.
Florida Constitutional Amendment 4 will save women's lives and protect their reproductive freedoms. It ensures doctors can provide life-saving emergency care to women. 65% of Floridians support abortion rights, and Amendment 4 was put on the ballot following a citizen-led initiative. Despite this, politicians in Tallahassee approved a draconian 6-week abortion ban, which denies women reproductive freedom. Stand up for women's reproductive rights. Stand up for democracy. Vote yes on Amendment 4 this November.
Well, I think it's all about local, and I'm a big believer in local. So I think anytime you can carry a message out locally, it's important. And I think it's anytime the person that delivers the service can also deliver the message, which is unusual. You have the people that actually deliver the project doing the talking, and I think that's a huge difference, and really makes a huge value difference for the consumer. So I'm really just so grateful that we have this local opportunity with Blab TV. My name is Quint Studer, and I am Blab TV.
And welcome back to your information network that is Sunshine's Corner. Hopefully you are having a fantastic Wednesday, because I certainly am. I cannot say, how much I appreciate Joy Powell, for doing what she does, connecting me with these ladies that are giving us the information that we need. Because of I say it every single day, knowledge is power.
Yeah.
And once you receive knowledge and find out things that you can do to better yourself, to help yourself health-wise, that is, money can't buy that.
Yeah.
We're talking money cannot buy that. And with the things that you guys are doing, it's absolutely amazing. I know some people that might be shy about calling, but don't be shy.
Yeah.
It's all good. 850-432-7768. You can text if you don't want to talk on air. But the fact of it is, we want to go back to Sister, because that's coming up next week.
Yes. We got the next, yeah.
They're on the 12th, right?
Mm-hmm.
This month is going to be gone. This is going to be gone before we know it.
But we have a lot of different education. So the screening part is amazing.
Yeah.
But if each one teach one, if you come and get the information, so you have in your toolkit, because that's what we're doing with these Wellness Wednesdays.
Right.
We're building your toolkit.
Yes.
No, you may not be a social worker or a community health person, but you have a network of people, and you will remember, hey, but Kelly was on Sonshine's show and she said, boom, 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 right? And so that's what we want. And you want to talk about what's happening as far as education, and then I'll come in with the Faith Health Network.
Talk, girls. I'm ready to take notes. Come on.
Yeah, well, we have a lot of education events going on, specifically this month with breast cancer awareness. So Baptist is amazing because we're sponsoring a lot of events with the Pensacola Breast Cancer Association. We have a Ribbons of Hope gala coming up for that. But then also we do have the Faith Health Network Academy class, where we're going to be talking about all things breast cancer awareness and education on how you should be doing your breast exams, what that looks like. We have pamphlets that we give out at all of our events that actually goes through the exam and pictures of what that looks like in case you've never done one before, and you need to know what that looks like. And then we'll also be at the Making Strides walk as well. We're a platinum sponsor, so we will have a lot of breast cancer education out there. We'll have the phone numbers of where you can call in order to get your screenings done. So we have a
UWF.
UWF. Yeah, we're a sponsor with UWF as well. So we'll be out there at their pink football game, the Packet Pink volleyball game. And all of those events are focused on education awareness for the community. The UWF events, we do get a lot of students, but then a lot of alumni do come in that are at the ages where you should be thinking about your breast health and going in to get mammograms. And if you're not comfortable or you're not the age to do that yet, at least knowing how to do an exam for yourself.
Okay, when you say the age that you should know, are there younger women?
Absolutely.
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 That should be aware of these same signs that we're talking about?
Yes.
And when I say younger, how young am I talking?
I'm navigating about 4 women right now in their 30s, early 30s with breast cancer. And it is a later stage breast cancer because of the screenings. They're not, not eligible for those screenings, but noticing it themselves. They're coming in that are going through treatment.
Right. So what we want to really reiterate there is for the younger people.
Yes.
That's, if you're taking your shower, do the same thing.
Yes. If you have developed breast at any age, you should be able to do a breast exam for yourself. Again, feeling under your arms where your lymph nodes are, feeling on your breast. And if you identify something and you bring that to attention of your doctor, then they can order a diagnostic, even if you aren't at the age to get an actual screening done.
But kids now develop so fast.
Yeah.
I mean, because you said anybody with breasts, they have them.
And I think that's important too. You always hear whenever you're doing your breast exam, call your sister, call your friend, say, hey, it's the first of the month, time to do your exam every single month. I think it's just as important as mothers encouraging their daughters. When you're going through high school and you're in college, so that becomes habit for them.
Right.
It's something that they know, and then they also tell a friend. So it's important to...
You can model it, you know? And I think that's part of that maternal, because children, of course, they're going to see what you do, and they're going to mimic that. If you place an importance of that for yourself as an adult, and you have a child that is now becoming an adult and they have breasts, then you're able to actually show them what that looks like, what to look out for. If they feel something, then you at least have that relationship where you can help guide them.
And I gotta go back to the Kingdom Walker, because he made such a point with the husbands.
Right.
And that's also a support system. I had never looked at it that way.
Yeah.
But for a man to call and to say that, that is a great point, because you know your wife's body as well.
But see, you have to also think about the tool that made him start paying attention. He was at work.
Thank you.
And he saw these diagrams.
Right.
I remember when I first started doing this about 20-something years ago, we used to have these little small breasts in a little box that was powdery, and we would hand them out and say, find it. And so we have to, even as healthcare providers, change our language. We talk about a lump, about how many centimeters. No, the size of a pea. Right. Because people know what a green pea feels like, right? And also, I want to say this. Know your family history.
Right.
We've heard in myths and stigmas, what happens in this family stays in this family.
Oh, God,
That has run its course.
Yes.
We need to know what grandmother had and what mother had, right? We need to know these things. And I remember a time when women were afraid to even talk about breast and things that, I got an aunt that had a full, is it a mastectomy? And we never knew. But that's important to her daughter. Because how am I going to be able to go and talk to my provider?
Right.
And you're my level 1 breast cancer.
And that's so important because for two reasons. Number one, based on your family history of breast cancer, that will raise your screening age. So if you have a mother who was diagnosed with breast cancer at 45, a lot of insurances will cover up to 10 years prior to that for you to start getting your screenings, but you have to have a documented family history. So number one, it may change what your screenings look like, but number two, it also makes you eligible for genetic testing. So when we talk about access and we talk about how can we set things apart and give people that knowledge and how knowledge is power, when you have a personal or a family history of cancer, you're able to then come through, when you come to get your mammogram, we do a risk assessment at Baptist where you enter in all that information and we give you the opportunity to do hereditary cancer genetic testing, which is just a blood draw. And we can send that into the lab for you, and they will tell you if you have any type of mutations that predispose you to cancer. And based off of that, you can then make decisions about whatever is applicable to you as a person. But those are things that are not available really outside of Baptist unless you have a diagnosis of cancer. So just based off that knowledge of family history.
Yeah. And it flips it from, especially with patients who do have a mutation, you open up the window for your children and grandchildren to get tested at a very early age.
Okay.
And that also turns things for them, rather than a be reactive stage once they get cancer, more of a preventative. Like, what do I need to do to make sure I don't get this?
Absolutely.
That I, am managing my health well.
And some options for that are, so for example, let's say that you get genetic testing and you do have a positive mutation for BRCA, which is the mutation for breast, right? You are then able to make decisions about, maybe I want to get a mastectomy and have a removal of my breast because I have such a strong family history.
Oh, you can
I'm
do it
very
ahead of time.
predisposed.
Correct.
Yes.
It's called a prophylactic mastectomy.
And insurance will then cover because you have that.
Google that.
Okay, please don't Google.
Don't Dr. Google.
Don't Dr. Google. Don't Dr. Google. But then when you have that testing, you have the results of that, and then insurance will be more likely to cover because you have the family history to be able to support the reasoning for it. So again, it's just about having the knowledge of knowing these are my options, and now I can do that option with, the option to be able to have
But you
coverage.
got to start with Thanksgiving is coming up.
Come on.
Sit at the dinner table before you slice the turkey.
Yes.
And ask the questions. Did anybody in our family have heart disease?
Yes.
Did they have diabetes? And hey, has anybody, even Grandpa,
died from it?
What? Had breast cancer.
Exactly.
Yep.
We got to know that.
Something interesting. I had a patient when we were doing their history, talked about their history. I think my granddad died of prostate cancer. Yeah, it was prostate cancer. And then come back a week later and say, no, it was breast cancer.
Oh, really?
I thought it was prostate cancer because men don't usually, it's usually prostate, not breast. So.
Unbelievable. You see the information we're receiving here today, ladies and gentlemen. So please take these notes. And the main thing I want you to do, get a pen and a pad. Write this number down. 448-227. Pray. We're known as a praying community anyway.
We are.
So pray. Call and find out. Make the appointment. Don't allow the fact that you don't have the proper insurance to stop you. Don't allow embarrassment or to stop you. Don't allow what Sue, Sally, Jane, Tom, Dick, or Harry has to say stop you. Get the testing done. And remember, they're there for you. And they're still there to help you. You'll find more about that right here on Sunshine's Corner.
Florida Constitutional Amendment 4 will save women's lives and protect their reproductive freedoms. It ensures doctors can provide life-saving emergency care to women. 65% of Floridians support abortion rights, and Amendment 4 was put on the ballot following a citizen-led initiative. Despite this, politicians in Tallahassee approved a draconian 6-week abortion ban, which denies women reproductive freedom. Stand up for women's reproductive rights. Stand up for democracy. Vote yes on Amendment 4 this November.
Let's work together to end breast cancer. October is Breast Cancer Awareness Month, and Blab TV and Sunshine's Corner, we're joining this year's annual Making Strides Against Breast Cancer Walk, and we want you to join us. Making Strides is happening on Saturday, October 26th, Seville Square, 8 a.m. A big thank you to all of our sponsors. We couldn't do it without you. And we can't end breast cancer without you. I'll see you there.
Gilmarine, your one-stop shop for all your boating needs. We offer a vast selection of parts, accessories, and electronics. Discover our range of used boats in every size, shape, and brand, all ready to get you on the water today. And we provide expert advice and top-notch customer service to ensure you have the best boating experience. We service all outboard, inboards, stern drives, jet drives, and personal watercraft. Our certified staff will get you back on the water. Visit Gilmarine at 3541 West Fairfield Drive, Pensacola.
My father told us he paid the cost to be the boss, which meant whatever he told you to do, you better do. So we were told you must vote. He would sit us down at a round table and go over the reasons why you needed to vote, why it was so important, that he fought for us to make sure that we could vote and that we were to fight for ourselves and for his grandchildren. My name is Jill Lewis-Staggs. I am the state committee woman for Okaloosa County, and I'm here to tell you, just vote.
And welcome back to Wellness Wednesday. I can't stop laughing. But we're having such a conversation because I'm learning so much today as we discuss how important it is for us to get tested. We were talking about Angelina Jolie. We both brought that name up. We were talking about the total, say that word.
Prophylactic mastectomy.
That's it.
Yes. Take them all off. You got to get into it health literacy. Just take it
them
off.
off. Yeah. Because she found out genetically.
Correct. She was BRCA positive, which is a gene associated with breast cancer.
Right.
Increases the risk exponentially for breast cancer.
Unbelievable.
I think a statement we were saying before is if you have a mutation, a BRCA, that's predisposed to breast cancer, it's not if you may get diagnosed. It's really a matter of when. It's something that is very important to know if you have that family history.
Best to be proactive.
Then reactive.
That's what preventive is. Preventive services. Proactive instead of waiting until, just let's be proactive.
Most certainly. I've talked and worked with Baptists for quite some time, but every time I do, I find out more. And since she and I have connected, it's like I'm finding out so much more that you all do. That's for the community.
And I would say this, Melissa is not just limited to breast cancer.
Right.
During the air show, the homecoming of the Blue Angels, we're there doing
skin screenings,
skin cancer screenings.
Really?
It's a lot. It's not just, this is just breast cancer month, but I think we do an injustice when we don't spend the time around the other.
Okay, so when you're out there with all the blues are blind, and you're doing skin testing with the crowd, how does that work? How you get them?
It's actually a really good event. We actually partner with dermatologists in the area that donate their time, and we set up in that the lifeguard tower. And they come and they will look at your body, look and see it if you're clothed, to be able to see if they identify anything that looks suspicious. And then we do connect you with their office after if you have a positive finding. Because I think that's another thing. If we're going to do a screening event, if we have a positive finding, we need to make sure that you have a way to follow up on it. So we do that every single year.
And we're in Florida.
And we're in Florida at the beach during skin screening.
And the sun's there.
But our department does multiple screenings. So of course we do the skin screening, but then we also manage all of the lung cancer screenings that come through Baptist. So if you order a lung cancer screening that's done at Baptist, that's done through my department, as well as screening colonoscopies. So we try to touch a lot of the major areas. We actually have one of the more higher number of diagnosed lung cancers as well as colon cancers in this area.
Really?
So it's this Northwest Florida area is very high with late stage lung cancer, late stage colon cancer. So we try our best to make sure that people understand that those screenings are available. And if you get those orders in, we will make sure they get scheduled.
When you say late stage lung, late stage
3 and 4.
What are are the symptoms? Is it something they're overlooking or?
Yeah, I think a lot of times people are, and I think a lot of times people associate lung cancer with smoking, which again, if you have to get the screening, you have to have been a smoker. But you can also have lung cancer without never have smoked. So a lot of times if you're someone who's never been a smoker, but you might have been predisposed to a secondhand smoker, or not at all, and you develop that and you are having a really bad cough that just can't resolve, things like that, you're not even associating that with cancer because it's not something that you even think is applicable to you because you have never smoked. So I think a lot of times people, again, are just going through the motions. You're trying to get through life. I have a really bad cough and I can't get rid of it, but I don't get seen about it, things like that. So we end up catching it later.
Those breathing machines,
the oxygen.
The oxygen, is that part? What can cause that?
That could be a whole lot.
Yeah, that could be a whole lot. Yeah, that could be a whole lot.
Because
there's a lot of lung disease. There's a lot of lung disease that's not specifically lung cancer. So
I mean, because I see so many of that.
Yeah.
I'll say 5 years ago, my brother passed away from lung cancer.
Yeah.
He had done well for years, till he came back. And when he came back with a vengeance.
Yeah.
And he didn't last 3 months after it came back.
Yeah.
But the fact of it is, I know what you're talking about when you're talking about that because I saw it.
Yeah.
And but I say to everybody, because we're down to the raw, can you believe you're having fun how fast the clock ticks?
Oh, yeah.
We got 3 minutes left. So I want to start at Joy. tell everybody about the event you got coming up on the 12th.
Okay.
Quickly.
Now? Okay, yeah. October 12th, Sister for Sister. It's going to be at our 9 Mile location at the corner of 9 Mile and University. If you are over 40, well, at least 40 and over, if you have no breast symptoms, no pain, no lumps, give a call. 448-227-7729. On October the 17th, I believe, which is a Thursday, Kelly will be doing our Faith Health Network classes where we bring all the congregations together to talk about women's health. And this month is just going to be breast health because we know what we need to do.
Absolutely.
There are some other wellness connections. So pick up your P&J on Sunday. You'll see our community benefit ad, or go to our website, www.ebaptisthealthcare, to see our breast cancer and support services for the month.
All the things that you're doing. And of course, the ladies here who has so much information, I thank you so much for coming. How, if a person want to get into touch with you, Kelly, what are they going to do? Just what?
They just give me a call. My 448-227-6018, and that's my direct line.
All right.
And mine is 448-227-6048.
Okay, you see these numbers, how you go. Just remember the 227, they'll get you to them, okay?
Yeah, 448. Baptist has a new area code. And if you're uncomfortable and you want to email, you can always email FHNinfo@bhcpns.org.
You got it?
Yes.
Ladies,
it's at the bottom of your screen.
There you go. It has been a fantastic day. I just want to say thank you for all of the information and taking the time to come in and just share. Because I believe, I say it every single day, knowledge is power. When you know different, when you know better, you're going to do better.
Exactly.
And know this, that there are options for you to get the help that you need. Do not allow anything or anyone to stop you from receiving what's there for you. Always know that if you pick up a phone to call for a pizza, pick up a phone and call for some help that you need at home, and don't be embarrassed about it. Thank you so much for doing what you do.
Yeah.
It is time for us to get out of here, but I am going to leave it with you as I do every single day. Why do I say this? Because I mean it from my heart. Never, ever, ever lose your focus. Always remember, if you keep God first in everything that you do, I'll guarantee you this, you're going to be a total success. So until tomorrow at 9 o'clock for another day of sunshine, know that I love you with a perfect kind of love. Keep shining while I'm gone. And thank you so much, guys, for coming in.
Thank you. Thank you for having us.
Okay, beautiful day.
Sunshine's Corner, being brought to you by Quint and Richie Studer.